Welcome back to Navigating Cancer. I'm Dr. Joey Bennett. I'm joined by Wendy Hall, and again today we're talking about skin cancer, and it's something, especially here in Florida, Wendy, that we all deal with, our family members deal with it, our children deal with it, so very important topic. Even though we're coming into the winter months, you can never protect yourself enough.
That's true, and I'm from Indiana, but the worst sunburn I ever had was when I visited Florida because we're not prepared.
I mean, you come closer to the equator and you're in trouble. What we talked about in the last segment was the basics of skin cancer. What I want to get into now are the three main types of skin cancer. When you hear someone say they've had a skin cancer, there's not just one. There are three major different groups. The first one is what we call a basal cell carcinoma. And fortunately, a basal cell carcinoma is the most common skin cancer that is diagnosed. And that's fortunate because it's also the least aggressive skin cancer. They don't tend to invade into other structures very quickly. They're slow growing, and they also don't tend to metastasize or spread to other parts of the body. So these types of cancers are very unlikely to cause someone to ever die from their cancer, but they can be disfiguring. And it's very important because the estimates are over 900,000 cases of basal cell carcinoma diagnosed in the United States every single year. It normally starts out, as you can see on your screen, as a reddish patch of skin. It may be a little sore that opens up and bleeds a little bit, something that just doesn't heal up. And if you notice this type of thing, this is when you want to bring it to the attention of your doctor, because basal cell carcinomas are highly treatable. The cure rate approaches 100% when you detect these cancers early and treat them. And later on, we're going to talk about the different treatment methods that are available for that. The second type of skin cancer that I want to talk about today is called squamous cell carcinoma. These are kind of an intermediary between the basal cell, which is well behaved, and the melanomas, which are very aggressive. Squamous cell carcinomas affect about 300,000 Americans every single year, so you can see much fewer, roughly 1/3 of those who get basal cell carcinomas. And again, it can look like a scaly red patch initially, but it may look like a sore over time. I often tell people, Wendy, that when they start getting these, it may actually have a little crater in it or a little ulcer in it, whereas the basal cells tend to be raised up little beads of pearls almost around the edges. Again, these are very treatable if they're caught early, but this is the critical part about squamous cell carcinoma. It can metastasize, it can spread, and there are people who die every single year in this country from squamous cell carcinoma. So even though it's a skin cancer, this one has to be taken very seriously. The third one that we want to talk about is melanoma, and this is the one that is most frightening to almost everyone. The incidence of melanoma is going up every single year in this country, and especially in Florida. And we are seeing more and more melanomas in young people who are spending a lot of time out in the sun, who are not wearing sunscreens. We're seeing more melanomas in people who are using tanning beds. And this is a very strong concern. Wendy and I were talking about it before the program started. When you look at the tanning bed utilization in this country, it's going up every single year, and unfortunately, we're seeing a lot of children in tanning beds, and it really bothers me immensely when I hear parents talk about their child is going to the tanning bed, getting ready for homecoming, getting ready for prom or something of this nature. Tanning beds are not a safe alternative to tanning. The only safe tan is a tan that you gradually acquire over time without having a sunburn. And for parents to sit here and think that my child can go to this tanning bed, it's safe, it's not, and they're setting themselves up for potentially life-threatening problems down the road, not only bad skin, bad complexion, leathery texture to the skin. I mean, these are all things that we really need to be thinking about, and unfortunately, a lot of young women think that tanning beds are a safe alternative.
Right, and men too.
I mean, yeah, blame it on us as well, but she's right. I mean, there are men that get in the tanning bed as well. Melanoma, though, going back to it, is the one that we have really got to pay more attention to because it is a deadly form of skin cancer. It's most often found on your trunk, your legs, your arms, or your scalp. It is very typically dark in appearance, may even have a crusty look to it, and is irregular in its shape, and we'll get into that a little bit more. Melanoma, again, is treatable, and the cure rates are high if you catch it early, but early means when it is very small and only millimeters thick of invasion. There are over 70,000 cases of melanoma expected to be diagnosed this year, and unfortunately, we're going to probably see around 12,000 deaths from melanoma, and percentage-wise, that rivals the death rate percentage from breast cancer, from prostate cancer, these other things that we all know so much about. So it's very critical to try to catch them. And what I tell people here with melanoma is if you've got a mole that all of a sudden changes and looks a little bit different on any part of your body, get your significant other, get your spouse, look each other over. If you see something that looks a little bit different, bring it to their attention. Have it examined. The worst thing that could happen is that you biopsy a benign mole, but if that mole has changed, that's when you've got to jump on it, because that subtle little change is an early sign that something's going on here.
And what about in the hairline?
I mean, even in the hairline, and it depends, I think, upon how much hair you have. When I was younger, I had more. And as we've gotten older, it's thinned out somewhat. People with really thick heads of hair don't tend to run into this problem that much, but people who have thinner hair, and this is both men and women, if your hair is thin, these areas are getting a lot of sun exposure. And I've gone out and played golf, and I have felt the sunburn on top of my head. I've actually seen some spray-on products that are like hairspray that you can spray in the scalp to try to get a little bit of coverage. But it is important. You need to look at every part of your body that is exposed to the sun. I want to show you some of the things on the next couple of slides of what we're looking at, and we refer to them as the ABCDs of skin cancer. And the A stands for asymmetrical. You want to look at how this thing looks. B is the borders or the edges of it. C is the color. Is it one color, multiple colors? And then D is how big is this thing? And on the next slide, I'll kind of show you a combination of things that you're trying to look for. In A, we're looking at asymmetrical. And if you look at this, you notice that it's not a perfectly little round brown dot. It's irregular. It almost, looking at it right now, has a starfish shape to it. On the B side there, you notice how it's very irregular. It's not a perfect little circle. It's not a square. It's jagged edged, and the borders are moving around a lot. That's very suspicious. Number C, or letter C there, is the color change that I talked about. You can see how on the left side of the screen, it's a darker color brown compared to a lighter color brown on the right side of it. And then the last one is just the diameter of it. If you've got that brown spot on your skin somewhere, and a little while ago it was the size of a BB, and now it's the size of an English P, and it seems to be getting bigger, then that's something to look at. But you want to incorporate it with all these things. You look for color change, size change, irregular borders. The safest thing is, if you're concerned about something, get it checked out by your physician or a dermatologist, because treatment is available for all of these. And when we come back, we're going to talk about your treatment options for skin cancer.